It is an honor to have all of you here, and that this is a momentous day that we are being a leader in Prince George's County when it comes to food as medicine. Let's give a round of applause to that. This is critical. We are at a time, when I first looked at food as medicine, I thought about chronic illnesses. And of course, as I'm trying to, on my own journey to get healthier, I realized that we needed to have a connection with our health, with the health options. However, what I would note there that I found is that we have this program, Food is Medicine, and we're not taking advantage of it in the state of Maryland. Mm-hmm. Last year, when I looked at this was a Medicaid waiver program that the state of Maryland could take advantage of. That was under Biden administration. But now we see the need has just increased this year. And at first I was even mad at myself that we didn't move forward with it last year. But when I look at this year, I said the timing was right. Mm-hmm. Because this does number one thing. First, it addresses the chronic illness. And as I've said before many times, the number one killer in Prince George's County is not gun violence. It is heart disease. Mm-hmm. And if we don't do something to make a difference in our community by putting forth programs like this to push our community to be healthier or to make it easier for our community to be healthier, we will only continue to increase in chronic diseases. And when another COVID comes, no one wants to be the top number when it comes to death. Mm-hmm. We don't want that in our community. But second of all, what I found is that we can use this to fill in the gap that this administration is bringing down on us by understand, we talking about SNAP now, but what people don't know, and I've learned from many of you in the room when we had our meeting, there was already cuts to the program, educators, nutritionists, educators that were funded by the federal government have already been cut. Mm-hmm. So what I want to say to you today is that this is not only necessary for our health, this is necessary for our survival. Mm-hmm. And as we look at the Department of Health and what the Department of Health is going to do of bringing a coalition together. We have our farmers. Let's raise our hand if you're one of our farmers in the room. Yeah. We have our farmers here who we believe will be connected in this program. We have our advocates here. Our advocates from the Capital Area Food Bank. Capital Area Food Bank, stand up. Feeding people every day throughout our community. What I just found out is that we have a food pharmacy at the University of Maryland Capital Region right in my district. And many of the residents are able to come there to get access to healthy foods that are provided by the farmers like Mr. Zama here. Mr. Zama, stand up. Assawana Farms. He actually gave 10 boxes of food, 12 boxes of food to our furloughed workers this Sunday. But this is what it's all about, connecting the gap, bringing everyone together. Once we pass this, I would say for the media, the next option is really looking for funding to do the outreach that we want to do. And we are going to do that when we get this passed. But we're setting an example. This will be the first official Food is Medicine program, I know in the county, Prince George's County, in the state. And one of the few in the country, but we're setting an example and we're gonna let people know that we are just here to make sure that our community is fed and fed healthy. Mm-hmm. So thank you all so much for your support. We have a couple of speakers today, but we have our council members, so I wanna get them to turn it over to our vice chair.
Oh. Well, thank you. I was just joking to my colleague. There are a few times that I'm jealous of a bill. And I was like, oh my God, wow, you hit it out of the park on this legislation. So I just want to say it publicly because I really think this is transformative and it's so important and it's so timely. When we have the message on the national stage basically saying that access to food does not matter and it's not going to be a priority anymore. That is really what we're hearing from the federal government. It is going to be crucial that our local governments start to stand up and say, how are we going to create access to food, and not just food. It's about healthy access. Because when we talk about one of the reasons why we have so much disparity in certain communities, there's this idea and this notion that people don't want to eat healthy and they need to be educated and they don't understand. But the reality is sometimes just simply cost, right? If you go to even a fast food restaurant, what's the cheapest thing you can get on the menu? It's not going to be a salad. Right? It's more expensive. So when you're trying to feed your family and you're looking at, am I going to purchase these, package of ramen noodles or this things that are sodium and they're high processed, or am I going to spend double to purchase enough fresh fruits and vegetables to make a meal? Then we look at the capacity of time, something that you can just pop into the oven or heat up versus what it takes to cook something from scratch. So there's a reality on the barrier of access to healthy options. And so a program like this allows us to do everything. One, look at access to food, look at making sure that people understand the benefits, making sure there's even classes that people can learn about quick and easy recipes and how to make, because some people think to make this food, it takes a lot of time, but they don't know quick, fast recipes that they can use to eat healthier. And so I'm just proud to stand with Councilmember Legay, who's been our champion when it comes to healthcare issues. Let's give her a round of applause, always thinking outside the box. And I know that we're gonna pass this legislation, and I know that we're gonna get the hard work done here in Prince George's County. And like always, we're gonna lead the way, and I hope that other counties and the state follows. So just thank you for your leadership. And now we'll have our council member representing the north part of the county, Councilmember Fisher.
I'm always teased for the north. Thank you so much. I just really want us to give a round of applause to Councilmember Walla Legay. Walla, I was standing here and I was teasing with Crystal. I said, Walla works hard, okay? She really puts her all into it, and she does it. What I respect about her, why I'm proud to vote and support your legislation and you, is that Walla doesn't just talk about something, she actually does the work that you don't get the accolades for, right? All of the meetings, all of the hours, all of the prep that your staff did to get all of the stakeholders together to actually put something together that's gonna have real teeth and real progress. I'm just very impressed. And the only thing I would say is, no matter where you live in Prince George's County, food access and food instability is something that I know our partners at Capillary Food will say is throughout every council district. Yeah. And the reality for us, and I was thinking about home today, this morning, food is really love in our community. Food is the way people show how they care about their children, their grandparents. Food is culture. And food also is there so much to be actually like a caring aspect of our lives. And I think it's more appropriate now more than ever when food access is being attacked, when our community is being attacked, that we find ways for our residents to have food work for them and not against them, right? And the reality for all of us is there's a lot of issues at the council we can talk about every day that maybe impacts some residents and doesn't. What I can tell you is that every Prince Georgian eats.
Right.
Every other thing we do might not impact everybody, but every single Prince Georgian, unless you're like a vampire or something, you're eating. And we have to make that daily activity not just, for some it's spiritual, for some it's family, some it's culture, actually work for you to have a better life and have healthcare prevention. All of the numbers, and I was talking to a friend the other day, I'm also with Walla on my health journey as well all the time. And it's like, I am not in a place as a person that I am trusting my health with this federal government or with traditional institutions. Like, I actually feel that way. And I think many Prince Georgians feel that way. And the best way to advocate for yourself, the best way to not be in the limb of a huge bill at a hospital or other things of that nature, is to actually take care of yourself. And it is hard in a community that's always doing for others, and especially for Black women. That is what I think about, who are always feeding and doing and working and stressed and carrying everyone else's load, than to actually put yourself first. But putting yourself first is a message of resistance, and we need that now more than ever. So thank you, Councilwoman.
Thank you. Thank you so much. I would like to call, we have a couple of speakers here who have been stakeholders, and I would like to call them up. I want to start with Joe Liu with the Capital Area Food Bank, if you can come up. And I just appreciate it because when we reached out to you, you immediately jumped and became a resource. So just a couple words, 1 minute.
I'm Joe Liu from the Capital Area Food Bank, the Director of Advocacy and Public Policy, and I just want to underscore how grateful we are to Council Member Blagay, the rest of the council, for their leadership on food as medicine, on food access issues. We are so excited that the county executive has raised the profile of food security by detailing someone into her office. We are looking for a countywide surge in effort to make hunger a thing of the past in this county. And so we are so excited for this partnership and such wonderful allies here. Thank you.
Thank you. Thank you. The next speaker, I just need to give credit where credit is due. I'm not going to pretend like this idea just popped in my head. I had someone special that brought it to me and said, you should do this. And he brought the idea to me. I had never heard of food as medicine before. But Arthur Somerville, can you come up and say a couple words? Thank you so much for putting this on my radar. And, you know, now I get to compete with she's our legislative guru here.
Thank you. My name is Arthur Somerville. I'm a healthcare consultant. I want to thank Councilor Walla Begay for her interest in diving into this after it was introduced to her. And just want to say that we really value preventative medicine, the future of healthcare, value-based care, what's going on. And I appreciate and thank everybody who was helpful in helping craft this legislation, including the guys from Plate RX, which is a health food as medicine app and tool in the area, and others that are very vital in this, including Anne Arundel Family Medicine and also Vital Table. So thank everybody for being here. I appreciate the support for this bill.
Thank you. Thank you so much. And I just want to know, he knows that this is preventative, and I just want to be clear, let's put that word out, because sometimes when people talk about some of our, especially Black communities, we're being reactive, but no, we're being preventative. We're getting to the issue before it comes. If we put this forward and we really push this, we are going to be the leader on this issue in a preventative manner, meaning healthcare starts in your kitchen, not the hospital. And I just want to know that. Mrs. Zama, can you come up? I just want to just note, just amazing. And I know he's got his phone here, so somebody can grab his phone so he can come up and speak. But we want you to talk about, you have been a leader on this, providing, not only do you have a farm in my district, but providing guidance on how the products on your farm can save our lives. So Dr. Zama, you want to say something? Yours.
Good morning, everybody, and thank you, Councilwoman Blagay. My name is Isaac Zama, and I'm a farmer up here in Upper Marlboro. We grow specialty vegetables, particularly our signature vegetable bitter leaf, which I'm sure some people would like to taste. We are very, very interested in the food as medicine program, and we would like to encourage everybody, to grow something. And I would like to invite Councilwoman Blagay and Fisher, that we are ready to help you to start growing your own food at home.
Yeah.
So we'll provide we'll provide all the help we can get. So thank you again, everybody, for coming, and thank you, Councilwoman Blagay.
Thank you. And I will warn, if you go to his farm, don't come with dress down clothes, because he will make you farm. He will give you the tools, and he will say, we need 10 minutes, and next thing you know, you'll be digging up dirt. So we appreciate you. I just want to turn it over to my colleague, Councilwoman Shaylin Adams Stafford, who's actually been such a supporter in wanting to expand this program in her district. So I always appreciate her support.
Absolutely. Thank you so much. And thank you so much, all of my colleagues, for supporting this wonderful, amazing piece of legislation. So speaking of farming, I just recently, my family, we started our own little garden plot with the help of the city of Glenarden, and we just had our first little snow peas come in. And I was very concerned because I thought that everything was going to be brown, because I have a brown thumb. But you know, we spent our time, and really what it showed me was that there is a lot of education that comes with eating healthy and not eating processed foods, and thinking about what we're putting into our bodies and how that really can be such preventative health. And I know that we've talked a lot about thinking about the dyes that are in our foods, and so I'm happy my colleagues will collaborate with myself on trying to remove red dye 40 foods from being sold in our schools, because we know that those types of ingredients can lead to all types of adverse impacts on young people. And so I'm really glad to see this legislation go forward and see how it will expand. I know in my district specifically, we're dealing with significant food insecurity, especially in the Fairmont Heights area. And so we're going to be working to try to bring a free grocery store to that region beginning in January. And so the Food is Medicine program is really going to be sort of that overarching sort of theme that will support us in supporting with food nutrition, helping people learn how to take meals that they're getting from the grocery store and develop food. And really, especially for people that have families, you know, preparing healthy foods that can last for several days, and meal planning, which I know for a lot of folks in my position, I have 3 young children, that is kind of where you get in the danger zone, right? Where you're just tempted to just stop and eat something fast and something quick, but really thinking more intentionally about not only things like gardening, but also sort of what we're purchasing at the store and how to cook it in a way that can be beneficial to our lives. And so again, I'm really grateful to stand with you on this, seeing how it will grow from everything using preventative strategies in our food dyes to, you know, supporting with getting rid of food deserts throughout the county, and really thinking about how do we use the educational component of this to teach families how to grow their own gardens and how to shop in a different way. So thank you so much.
Thank you so much. We have 2 more quick speakers, and I just want to bring them up. First, I want to bring Ms. Denise Ware Jackson from Prince George's Community College. What people don't know is we already were at the head of this, and that's what I found there. We're just trying to tell the world what we've got, and we have a program at the community college that's already been working in this area, and we're just going to activate it even more. So let's bring her up.
Good morning. Thank you. Good morning, everyone. We are definitely excited to be a part of this program because we offer the Food is Medicine and the nutritional education, talk about reading labels, and also bringing it in the culinary kitchen. So we have a grant and a partnership with the University of Maryland Medical Center where we'll be rolling out in February so that we can bring people into the garden, into the kitchen, so that they can learn the aspects of eating healthy and what it really takes. And food is medicine. So what you put in is what you're going to get out. So thank you, and we support you 100%, and thank you for your time.
Thank you. I would like to recognize, we have organizations who actually, what we didn't know, and I'm sure my colleagues didn't know, there was actually a food as medicine pilot program that was done in 2021. And we have some advocates here that were around during that time. Is Michelle Burton here? Okay, good. You can come up. And thank you so much for your work in this field before. Wanted to highlight what was done before.
Thank you so much. This is really exciting. I remember when this was just an idea in 2019 that was started with the Prince George's County Healthcare Action Coalition and our fellow advocates. So I'll share more about that later during the council session. But you can feel free to check out the report. It's on the pgfec.org website. And we are just so thrilled that this has finally come today. Thank you so much, Councilmember Blagay, for inviting us.
Thank you. And for our media, so that you all know, what we found is that with that pilot, the pilot was actually focused on food insecurity. And it was more of a food insecurity than just health. And so just bringing it together at this time is definitely necessary. Last speaker, but not least, do we have Lynn here with Food is Friends? Yes. Okay, yeah, so we wanted the Food and Friends to say a couple words because you guys have been a big part of actually working, doing the actual work in this field. So we want to give you a couple words to say.
Oh, thank you. Hello, everyone. My name is Raisa, and I'm with Food and Friends. We serve Prince George's County with medically tailored meals, medically tailored groceries, coupled with medical nutrition therapy. And what we do is we meet people when they are coming out of the hospital. They have chronic disease, diabetes, cancer, maybe they're in hospice. And what we do is we bring them that healthy food that's tailored specifically to their condition. And so in the food is medicine pyramid, it takes all of us, and we're at the top at the intervention part when people are ill, and we need to all come together to support this bill, support Councilmember Blagay, support all of Prince George's County, and bring healthy food to our neighbors and keep them out of the hospital and keeping them going on their health journey. Thank you all, and thank you for your support.
Well, I want to thank you all so much for coming out today. As you can see, this is going to be a huge effort to put our to bring our community healthy. We want to start. We already have the programs that provide medically tailored meals to those who are sick, but we want to start before people get sick. And especially if we have food insecurity, we want to start those that are facing food insecurity. We want to start them with, meals that are healthy. So this is a turning point. Do we have any questions from the media before we close? Because we do have to go to session. Yes.
Yeah, sure. I know you mentioned this briefly, but if you could talk a little bit about the once it's passed, kind of the timetable, what this would look like once it's up and running, and the funding for it. Is there money for it now, and how would that work?
We do believe that we will work with the executive to put funding aside for it. As budget is coming up, we're going to be looking at that, but we want to get it passed first. I will say this, the administration has already committed to putting the program together, bringing all the stakeholders together, having the staffing to do that. They're going to start that off, and then we have a task force that's going to come up with recommendations under the legislation that is going to give guidance on how this will move forward in a more organized way. We do plan on trying to find money and get money into it. We do think now is a better time to push for the funding because of all the insecurities at the federal level. We do recognize that we need to implement some sort of program at the county level that we can help fund that process at the county level. And that will be the goal going forward. And I think now all stakeholders see how important that is versus before when there was a lot of federal funds to put this for. Even when I brought it up before last year, one of the things that I got back was like, well, that's more of a federal program because it was state, but with Medicaid. But now I think that all stakeholders understand that we have to do something at the local level. Yes?
Yes. I was just going to say, you were talking before about how important this legislation is given all the cuts that have happened. Federal level, everything that's going on with SNAP benefits, it's still unclear when those SNAP benefits will be given out to people. So just, you all are trying to push this out. Do you know how soon these resources are going to be available for residents?
We will try to get them out soon. Obviously, the bill, once passed, it still has 45 days for implementation. So we are trying to do, but I do believe that we have talked with the Department of Health leaders who have committed that they will try to do something to get this going a little faster. But but obviously with administrative strain, we're trying to do as much as we can. So we will be the push of this. Part of this is just getting it passed because once it's on the books, it's a lot easier to say, okay, we need to quickly get this done. And we, as my office, will help the administration by putting all stakeholders at the table for this to get that going. So we will do that. I will say one of the things that we did see that has been cut in funding that we're trying to address has been things like nutrition educators, things like that. Those are things that we can start with and connect people that, like her program there, we can start connecting our residents to that. One more question because we do have to start council. Yes.
Hi, Patricia Holloway, as a health minister and First Baptist Church of Illinois. Is there any partnerships or desires to partner with other faith-based communities?
Yes, that's part of the bill. So we want that, and I'm glad you're here so we can get your information. But we will have the Department of Health will do a call out to the general community so we can add more than what our office has. But we do have a list, and we will now that we're connecting with you, we will send it forward. Thank you all so much for coming to our press conference today, and look forward to seeing you all in the council hearing room.